Yeah, so this is it. I think I've tried to make the calculations or the data analysis part a little bit compressed. I hope you will be able to connect everything. So maybe I'll just start by, in terms of what you're supposed to cover in public health data analysis and framework. I think it outlines basically the systematic approach of turning your health information into evidence that can guide prevention, policy, resource allocation, and even program improvement. Yeah, so those are basically what you're going to look at, and it's a step by step. We start by defining what is a research design and research methodology. So this part I'll take the shortest time possible before I go into the calculations. So research design is basically a blueprint that explains how participants are selected, how exposure and outcomes are measured, and how the research questions will be answered. So the design determines which calculations are valid and how strong are can the conclusion be. So the main classification in terms of research designs are observation. So basically, you observe without assigning any exposure. So the main purpose is to describe pattern or examine association. Then we have an example of observation is a cross-sectional or a cohort or case studies or the ecological studies, yeah, where you essentially observe without assigning any exposure. Then you have experimentals, descriptive, where we're going to really do a lot, then analytical, where we're comparing groups. So I've tried to have them in form of such. So measuring association. After measuring association, we're going to look at screening tests. Before that, I think we have measures of disease frequency. So those are some of the things that we're going to look. Yeah, I think then we are going to fill in. We are going to be done. So descriptive things like describing a person or places in time, measuring the burden and the generative hypotheses. Analytical increased testing of hypotheses. So for testing of hypotheses, again, it will be theoretical, but I hope you will be able to catch up, because for these ones, for testing hypotheses, we need to do a full program. You're going to use either SPSS or Stata or even Python or R to do the entire thing. So for this one, we're going to just jump in. So something to remember, look at, for example, if you talk about observation studies, look at how observation studies are done. Things like, I think, ethnography studies, where you look at patients in their natural location, such kind of things. Look at some of the advantages and disadvantages. Also for analytical studies, try to understand what is cohort, case control, cross-section, ecological, and such. Strength, weaknesses, where they use, and such kind of things. Yeah, I think that would really bring you to speed. So the next part is measures of disease frequency, and disease frequency measures or what try to quantify how much disease exists or develop in a population. So the denominator must always match the population and could contribute to the numerator at certain point. So the first thing that you're going to look at is what you call, this is quite clear and visible, what you call a cumulative incidence or risk. So cumulative incidence is a proportion of initially disease-free people who develop the disease during a specified period. So these people were free, they were disease-free, then they develop during the specified period. An example here is a cohort includes 2,000 people who are free from influenza at the beginning of this January. 160 people develop influenza. Calculate the cumulative incidence or risk. So how do you calculate that? So for cumulative incidence, it's essentially, this is the cumulative incidence. That's how I'm going to be abbreviating that. It's essentially what you call the new cases during the period over the population at risk at the beginning. So this is going to be the new cases during the period over what you call the population at risk at the beginning. So how do you calculate that? So if you look at this, a cohort includes about 2,000 people who are free from influenza. So these are the population at risk at the beginning of the year. 160 people develop the influenza. So how do you calculate the cumulative incidence or risk? It's basically going to be 160 over 2,000. And this is going to be, so I think you can just use your calculator, or you can just do the calculation. So in this case, I'm going to have 160 divided by 2,000. So we're going to have 0.08. So this 0.08, if you want it in percentage, you multiply by 100. So it's going to be 0.08 times 0.08, I mean, times 100, which is going to be what? 8%. So for 8%, it's basically 8% of the initial disease-free people population develop influenza during January. So how to interpret is basically, we can talk about 8% of the initially disease-free people develop influenza during January. Yeah. So something to remember is people who already have the disease at a baseline are not at risk due of becoming new cases and should not be included in the population at risk for cumulative incidence. So you need to remember that, because these are people who are already having the disease at the baseline. They are not at risk of becoming new cases and should not be included at the end. Yeah, so the next indicator is this, the incidence rate. So an incidence rate, it uses the person time, and it's basically useful when participants are followed from different length of time. So incidence rate is essentially the number of new cases over the total population, new cases. So in this example here, a study observed participants for a combined total of 5,000 persons in years. Then during the follow-up, 75 new cases of tuberculosis occurred. Calculate the incidence rate. So in this case, we are trying to look at persons in time and have been followed for a length of time. So in this case, we are having the number of new cases, which is 75, okay, over, I don't know whether that is clear. I can move it a little bit down. Just a moment, so that I don't compromise much on you training to see. I think that's better. Yeah. And the total person time at risk is 5,000. So the total person time at risk is 5,000. So this one again, you can always do the math in your head, just dividing by 5 until you get the lowest, but I think calculator will make your work easier. Divide by 5,000. You get 0. So 0.015. That is the incidence. So per 1,000 person years. So it's for incidence, it's always per 1,000. Per 1,000 person. So in this case, we're going to multiply this by 1,000. So it's going to be 0.015 times 1,000. And in this case, we're going to have 15. So this is like this 0 is going to cancel. The 3 zeros are going to cancel with the 3 decimal places. 1, 2, 3. I don't know whether that makes sense. So the decimal place moves. These are so 15.0, which is just 15. Because narrow down back to that. So in this case, how do you interpret this? The tuberculosis incident rate is 15 new cases per 1,000 person years. So the TB incidence rate is 15 new cases per 1,000 person years. So essentially by, yeah. I hope that makes sense. The next one is what you call prevalence. So for prevalence, it basically measures the proportion of a population. Hope the question is clear and my screen is visible. It measures the proportion of population with a disease at a specific time or duration. So it includes both old and new cases. Let me just add that one here. So if you remember at the beginning, we were talking about was it? I think we were talking about the cumulative incidence, and we said that people who already have the disease at baseline are not at risk of becoming new cases and should not be included. In the prevalence, now we include both the old and the newly developed cases that are present at the time of measurement. So in this case, we include both that are present at the time of measurement. And in this example that I've given here, we are saying that on 20th July 2026, which is today, let me charge my laptop. I can see the light has reduced because I'm using light from my, yeah, so I think this is that okay? Let me check. Okay, let me check. I think that's I think this is okay. This is okay for me. I hope for you as well. Yeah. So we are saying on the 20th, which is today, July 2026, a community has about 3,500 residents, of whom 280 have diagnosed hypertension. Calculate the prevalence. So we are talking about prevalence being the population, a proportion of a population with the disease at a specific time or during a specific period. It includes both the old ones and the newly developed cases at that time of measurement. So in this case, existing cases, prevalence is, the point prevalence is basically equal to the existing cases. I don't know whether that light is really good. Let me switch to one. Yeah, I think that's okay. That's okay. Yeah, sorry. Yeah, so existing cases at a specific time over the total population at risk at that time. So in this case, we are having our prevalence being equal to 280 who have been diagnosed with hypertension. Those are the existing cases of at that specific time. 280 over the total population. So in this case, we are having 3,500. 3,500. So for this 3,500, so for this 3,500, we're going to divide, and you're going to get that. So it's 280 divided by 350. Yeah, so it's going to be 0.08. So, so in this case, you can change this as a percentage where we multiply by 100 and you get 8%. So 8% of the community had hypertension on the 20th of July. 8% of the community had hypertension on the 20th of July 2026. Yeah. I don't know whether that makes sense, the question and how it has been answered. Okay. The next one is mortality and the case fatality. So mortality is the number of deaths during the specific period over the population during the period again, times, we're always using a couple of 100,000 person or populations in this case. We're going to look at a country with 500,000 residents records 250 malaria deaths in a year. In 1 year, that's supposed to be 1 year, in 1 year. So how do you look at the mortality rate? I don't know whether this makes sense. So for the mortality rate, we're going to have it as the number of deaths during that period, of the total population during that period times per 100,000 persons. So in this case, our mortality rate is going to be equal to the number of deaths during that period, that is 250, over the population. The population at that time was 500. Then this is supposed to be per, this is basically the 10 to the nth number. So we are going to have per 100,000 persons. So in this case, this 30 goes with 30, this 20 goes with 20, this 5 goes into 25 5 times. Then there's a 0 here, which makes it 50. So in this case, we are having 50. That is the mortality rate. Per what? Per 1,000 population per year. So malaria mortality is essentially at 50 deaths. Malaria mortality rate is 50 deaths. Per what? Per 100,000 population per year. Yeah. I hope that is clear and makes sense. So the number of deaths during that period, remember there is that multiplier. So it's always per what? Per 100,000 population per year. So if it's, because if you divide this, you're going to get 0.00 something. If you divide 50 by 50 divided by 500,000, you're going to get about yeah, it's 250. Yeah, I mean 250 divided by 500. You're going to get something like this. Multiply by, these are 100,000, so you're going to get 50 death. The mortality rate is at 50 deaths per 100,000 population per year. Make sense? Good. So the next is what we call case fatality. So for case fatality, we are talking about death among diagnosed cases. So people who have been confirmed, they have been diagnosed and confirmed to have that over the total diagnosed persons or cases. So in this case, case fatality is quite different with the mortality rate. You need to remember that. So in this case, we are having, during an outbreak, 400 people were diagnosed and 20 died. Out of these 400, 20 died. So we are having only the population that was there. Assuming maybe you're looking at during COVID, people who were tested, who tested positive, and from these people who tested positive, how many died? So we are talking about 20. So the case fatality rate is going to be 20. So that's the people, death among the diagnosed cases. So in this case, we're having 20 over the total population who were tested and the case that they were diagnosed with the cases, that's 400. So in this case, we are going to have this goes there, then that's 1, that's 2, so it goes 0.5. So it's basically 0.5, that's 0.5, yeah, 0.05. Then we multiply by 100. So in case you need to have your calculator, you'll need to check the actual value divided by 400 times 100. So you're going to have 0.05 times 100, and we're going to have 5%. So in this case, we are talking about 5% of the diagnosed cases died. The case fatality reflects essentially the severity among the cases. It's not mortality in the whole population. The only ones that were diagnosed with the specific maybe disease. Yeah. Good. So the next part is that's the end of measures of disease frequency. Now we're going to the next part, which is measures of association.